I'm Dr. Johanna here and Dr. Madeline. And for this video, we're just going to pretend Dr. Madeline is pregnant because we're going to show you what Webster Check actually looks like and what an exam looks like on a pregnant mom. So the cool thing is we do have these really awesome pillows, and both of them have a cutout in the middle, and that's so mom can actually lay face down and we can see what's going on the backside.
Moms love this too, especially if they're coming to us later in their pregnancy, because they can lay down on their belly for a couple seconds.
Yep, absolutely. So go ahead and assume the position. And if you watched our previous video on what we are looking for Webster, we're looking and paying attention to the lower portion of the body here. So I'm going to walk you through just a couple of things that we're checking for. And then I'll show you the rest of a quick exam on what we would do with the patient. So my patient, Dr. Madeline here, is pregnant and she's having some low back pain. Maybe she's having some sciatica, or baby's not in the right position. So we're going to do Webster on her. And I'm just going to bring these heels up to the tush and look for any type of restriction or imbalance that's happening. Based on what her body tells me, I'm going to adjust those segments. Part of Webster is finding the misalignments in the spine and the pelvic region, but also checking those muscles that support the spine together. So I'm just going to feel for some tight fibers or some trigger points or some tight muscles, whatever you like to call them. And part of it, and moms love this, is we're going to work some of that issue out by doing a gentle release on those muscles. So this is working the supporting muscles to help loosen them up so everything is balanced. And I am going to be close, and I'm going to check in around her tush. I'm going to let her know that so she knows I'm going to poke in right around where she sits, because we're looking for one of those tight ligaments as well so we can release that. That'll take pressure off the uterus, which is in the front. That connects on the back where she actually sits, allowing for more space in utero for baby. So we do that. And then we would do an adjustment based on what she would need. The tables pop up and they drop down based on the weight of your body. It's kind of loud, so for the video, I'm not actually going to perform it, but she doesn't need that adjustment. So we're just going to pretend like she does, and we would do a gentle release in that area. And we all are about patterns and making sure everything's balanced, so we go back through and recheck and go to the next thing. So we also want to check that low back when we're talking about pregnancy and postpartum, and we get the areas adjusted here. Same thing with the drop table to make sure everything is aligned. And then I'm going to have her come on up off that table, and we're going to switch because things can be out of balance in the back but also the front. So Dr. Madeline's going to lay on her back here, and we're going to check. So if she was pregnant, right, she would have her uterus here and it would be expanding with baby. So we're going to check the muscles and joints on the front side. Bring your arms up to me. I'm going to stretch you and you're going to high five yourself above your head. And this shows if a muscle called your hip flexor or your psoas muscle is too tight. And we would do a nice gentle muscle release. This muscle runs from your low back and it crosses over to the front. So if it's too tight, it can cause a lot of restriction in the amount of space in utero. So we just nicely release and loosen that up. Helps alleviate low back pain, which is amazing, and sciatica, so that's cool. Then we're also going to check those round ligaments, which are running on both sides of that uterus, right? So we just go through. They have muscle fibers in that ligament, so it's one we can do a trigger point release on and help loosen it, and it frees up space in utero. And it's pretty cool because as we do this, it's totally okay if the baby moves. We're not hurting the baby, we're not touching the baby. It's totally safe and effective for that. And we always would check both sides. The other thing is a lot of moms come in with a lot of pubic bone pain. We're going to check that. So I'm going to touch your pubic bones, and if they're out of alignment, we would adjust that with something called an activator, which is a nice little handheld tool, and it clicks and it helps realign that joint fast and effectively. And then let's see those hands. Let's make sure you're balanced back out. Good. Relax those hands down. And from that is Webster. So anything else we would check would just make sure that everything in the mid back, upper back, and neck is in proper alignment as well, so you feel more comfortable and balanced.